Layla McCay joins us, Director at the NHS Confederation. I guess this pandemic has highlighted weaknesses in the social care system, but we kind of knew they were there already. What do you think should be done now in the short term?
That's absolutely right. There have been many years of insufficient investment in social care, and I think that something like the coronavirus pandemic really highlights the impact of that. We see the NHS as having a lot of focus, there's a lot of investment, whereas what we're hearing from our members in primary care and the community in care homes, that they really feel like they haven't quite had that level of focus. And of course, right now, care homes is where the coronavirus battle is raging. So it's been really illuminating to see the disparities in different parts of what is essentially one big system.
Well, that's the problem, isn't it? It's not one big system, it's two systems, and until recently, barely the twain shall meet. Now, the Department of Health is now the Department of Health and Social Care, but it's going to take a long time to integrate everything. What can be done in the short term, though?
Absolutely. In the short term, I think that working to look after patients during coronavirus has shown people the benefits of working across the health and care systems, and it's made people really keen to do that in a more effective and collaborative way going forward, because actually it has been quite effective at the moment. What's needed in the short term is investment to help the people who are working in care homes to be able to deliver the care that they need in the safe environment that they need. And that means making sure that they are now prioritised for things like PPE, for things like testing, and for the training to make sure that they're able to deliver the right sort of care to manage this very particular situation.
But that is happening now, isn't it? They are being, it should have happened before maybe, but they are being prioritised for testing and indeed provision of PPE. I haven't had any people from care homes phone in, people who work in care homes over the past week or two, saying that there is a lack of PPE any longer.
I think that things are definitely getting better. And what we hear with this new investment that's been announced is we're really just keen to see that the money does go to where it is most needed, with local leaders involved. I think that while the PPE situation is improving, certainly we're still hearing that there are challenges. There are challenges in every part of the system, including care homes. And what we need to see is that the staff and the residents of care homes are now really being prioritised, that these distribution issues are being sorted out.
Layla, I'm sorry it's been so short, but we have to move on. Thank you very much. That's Layla McCay, Director at the NHS Confederation.